I don't know how many of you know that under the ADLs, we might put instructions specific to that ADL. You can also write notes under the ADL as well as the tab on your app that says notes. So you can write notes specific to the ADL, a quick note, or by all means you can make those notes in the notes section. So things that need to be documented. I really want you to think with me here. I'm going to give you a little scenario. I want you to use all of your senses. Think about when you walk into a client's home. What do you see, smell, hear, feel? Those kinds of things. But I'm going to play along here with me and I'm going to give you a little scenario. Let's pretend that you are walking into the home of your loved one. Maybe your mom, maybe your grandma. So you haven't been there in about 3 weeks. So picture wherever that would be for you, whosever house that would be for you. I want you to picture that in your mind. You're going in to see either your mom or your grandma. She lives a couple hours away from you. So it's not like you can get there, sometimes even weekly. It's hard, you're busy. So you walk in and she comes shuffling to meet you. Instead of her usual stride to come and meet you, she gives you a hug. It's been a while since you've seen her. Her hug is barely a hug. You can feel her arms around you, but there's no strength. She feels so thin. You look over her shoulder and you see a pile of mail on the dining room table. It's all unopened. As you walk in, you notice there are papers all around one empty little spot on the couch where she sits. She offers you something to eat, and you notice after she scoops up some ice cream for you that it really tastes like onions. Ugh. She probably had only rinsed the bowl, not washed the bowl. You notice that the tap in the kitchen is dripping over a stack of dirty dishes. I wonder how long those dishes had sat there. Is there anything growing on them? You notice the faint smell of urine when you walk towards the bedroom and the bathroom. Can you identify all the things in that little scenario that you either saw, smelled, felt? Let's talk about the senses of the elderly. They usually lose hearing. Has the client or your loved one, whichever scenario you're looking at here, have they had a hearing test? Maybe an amplifier would help if that's the case. Maybe they just have a wax buildup in their ears that needs to be addressed. Amplifiers are much cheaper than hearing aids. I get them for my brother. He goes through about 2 pair a year and they're about $50. What about their eyes? Does your client or your family member have cataracts, which cloud their vision? They don't see as well. Maybe she thought the dish was clean, but she couldn't tell. What about glaucoma? macular degeneration. When was their last eye exam? Maybe they need some new glasses. How about taste? Maybe things don't taste good to them anymore. There are things that could be affecting taste. Medications sometimes leave an aftertaste or change their taste buds. Parkinson's. I think Parkinson's affects smell as well. Even dentures change what you taste. And I didn't realize this till my brother got dentures. You know, in your mouth, your tongue, of course, has taste buds. But when you savor something, your tongue goes against the roof of your mouth for texture. Stick your tongue up there and feel it. When you have an upper denture plate, that plate covers your palate. So then you have this plate that has no feeling in it. You can't even tell when your tongue is touching it unless it is pushing it, and then you can feel that against your palate. How about touch? Maybe they have carpal tunnel. Maybe they have poor circulation. Maybe they have neuropathy. Sometimes when people go through chemo, they experience neuropathy. And that can be hands or feet. You know, it's hard to have confidence where you're walking if you can't feel where your feet are going. Document what you see. Document what's different. In the scenario that we talked about, we saw a change in her gait. Describe it. And then maybe wonder why. Again, is there something going on with her feet? Are her shoes so stretched out that she's shuffling to keep them on her? Is she complaining of pain? Does she have a limp? Is it unsteady? Her hug. You noticed that there wasn't much strength in that hug. You barely felt it. And she felt thin. Has she lost weight? Look in the fridge. Is there food? Is there food with mold on it? What has she been eating? Are there any protein drinks? When was the last time she was weighed? Let's talk about the pile of unopened mail. There's papers all over the couch, which obviously she opened some of that, but did she read it? Could she see it? Or is she just overwhelmed with the pile of mail? We just came back from vacation and we had so much mail, and believe me, 99% of it was junk mail, advertisements. But there was so much mail, they had to give us one of those mail bins to hold the mail. It was overwhelming for us, and most of it was junk. Is she depressed? Are there any late due notices on bills? Can she no longer make a decision on what is junk mail and what to throw away? Is there enough light for her to see, to read the mail? Or is she losing interest? I wonder why the ice cream tastes like onions. There was a pile of dirty dishes. Maybe she just rinsed that bowl out for your ice cream. Is she not getting the dishes clean because she can't see? I wonder how long they've been sitting there. Faint smell of urine. Is it on her clothes? Is it in the bathroom? Does she have clean underwear in her drawer? Does she wear adult briefs? Maybe it's just the garbage can in the bathroom that smells. Maybe there's wet briefs in it. Or maybe she didn't make it to the bathroom in time, had a little incontinence. Maybe there's urine on the floor that didn't get cleaned up. How is her hygiene? Just look at her. Any obvious body odor besides the faint smell of urine, but that was when you went past the bedroom and the bathroom. What does her hair look like? Has she combed her hair? Has it been washed? Does she need a trim? What do her clothes look like? Are they baggy? Another indication maybe that she's lost some weight. Are they dirty? Is there food on them? Are they wrinkled? Maybe she's sleeping in them. Has she been doing laundry? Or is there a stack of dirty clothes? Can you tell if she has showered lately? What do her fingernails look like? Are they broken? Are they dirty? Let's talk about that drippy faucet. Did she even know it was dripping? Did she ask anybody about it? Is there anything else in the house broken that you can tell? Are there lights that don't work? Maybe they need light bulb replacements. Is there anything in the house that could be dangerous? Are there cords across the floor? Maybe an outlet isn't working. Is there a carbon monoxide alarm or a smoke alarm? Or are the caps off because there's no batteries in them? Is there a sump pump or a furnace issue or an air conditioning issue? Is there a humidifier that needs to be emptied? How about medications? Is she taking them? Does she set them up herself? Does she set them up in, a pill dispenser Monday through Friday, AM, PM? Or sometimes they have their own system of once they take the pill for the day, they flip the bottle over so they know as the day progresses, they all get turned the same way. Sometimes they have their own little systems of doing that. But maybe check the dates of when they were last filled. Is it time or is it past time? If it's past time for them to be filled, chances are she's not been taking them as prescribed. Is there anything visibly new on their body? Cuts, band-aids, scabs, bruises, bumps, lumps. If her gait's unsteady, is she in need of a cane, a walker? Does she complain of pain? Is there any skin breakdown, abnormal swelling, shortness of breath? Again, you caregivers are the eyes and the ears for the clients and for their families and for us. What observations can you see regarding their mood or their behavior? How did your mom or your grandma greet you, or how do your clients greet you? Do they acknowledge you? Do they smile? Do they genuinely seem glad to see you? Or is she unusually quiet? Are they able to hold a conversation? Do they seem to hear you? Are they aware of time, place, and person? Are they repeating themselves? Anything that you notice that's out of place, like maybe she forgot where something goes or just misplaced some things. Can you engage them in conversation, in coloring, games? If so, document the activity. Do a quick safety check. Check around for trip hazards, dropped things on the floor. They may not even be able to see some things on the floor that they drop. Again, if their vision's not good, or maybe they tried to pick it up and the dexterity of their fingers isn't good and they couldn't get a hold of something. If they've lost weight, are their pants too long? Is there anything that's happened that has upset them? Like they've lost their keys, they've lost their purse. Do they know how to lock the door? Are they capable of still driving? Report any of these changes that you see in your clients. Report them in your documentation. And if you want to call us or call a family member, by all means, document that. You have notified us. All right, let's talk about when. When do you document? Document findings during the shift, if at all possible. That way you don't forget to document something while it is fresh on your mind. Again, in Access Care, you can document throughout the day. I don't think it assigns any times, so you might want to put, when you're making an entry, the time. The date shows up because you can only document on the day you're there, but I would assign a time to whatever time your entry is. You can do the ADLs the last 5 to 10 minutes of your shift. If your client asks what you're doing, because sometimes they worry about you being on your phones way too much instead of paying attention to them, just let them know that you're doing your documenting for the day. They would accept that better with you telling them what you're doing than you doing it over there in a chair and they think you're doing something secretive. Document something every shift, even if it is something like no change in physical condition. But be sure you are documenting how well someone is getting around with their walker, their cane, transferring to the wheelchair or to the toilet, if some of these things are related to an ADL task. Document when you make phone calls and to whom. Date that time and entry. Document what you've reported and what you were told in response and instructed. Document when an incident or an event occurs, what you did to respond to that event, and who did you notify about what was going on. Where do you document? Document where you cared for your client. Did you go anywhere? Did you go to a doctor's appointment? Did you go out for a drive? Did you pick up prescriptions? Did you go to the grocery store? Document where you went. Did your client go with you in the store? How did they do? Did they hold on to the cart? Did they use their walker? Pay attention in the store. What is your client buying? Are they buying the same thing each time you go into the store? We had one lady that would buy groceries, and when the caregiver got home, the pantry was so full of the same groceries, the lady didn't need groceries, or those particular groceries, but she was buying the same thing over and over, and her pantry had no room for anymore. Is your client buying gift cards, lottery tickets? Especially if they're buying a lot of them at once, could be indicative of some harassment, some financial scamming going on. There are so many senior citizens that have been scammed on phone calls and instructed to go buy. And I got caught in one of these myself. I mean, I was literally shaking in my car and felt so sick to my stomach because the person on the phone had me terrified. So it happens. And one of the keys is that these people instruct the senior citizens, myself included, to go and buy like 15 gift cards for $50 a piece. So pay attention to what they're buying. Maybe ask, are these birthday gifts or something? But if they tell you it's because so-and-so called and my grandson's in jail in another state, and if I send these gift cards, they'll let him out. Chances are none of that's true. Were you able to engage your client to go to any activities outside the home? Maybe bingo, shopping. I know we have one client that sometimes gets taken to a Legion dance or an Legion bingo. Last but not least, we've covered who the documentation is for, what to document, documentation of where your care is given and where you guys go, and when, document when you do things, when things happen. Now we're going to talk about why. Why, and we touched on this in the beginning. Good documentation provides a means of communication between the members of the home care agency and participating agencies. Sometimes we work with home health, palliative care, and hospice. It provides good communication with insurances, family members and attorneys, physicians and paramedics, and in the event of a dreaded audit. It allows for coordinating and planning and providing continuity of care for your client. We had, back in the day when we had notebooks, we had paramedics take our notebooks in the ambulance with them. We have received calls from physicians about clients because the caregivers sometimes know as much or more about what's going on with the client than the family does, especially if the family is out of state and not real involved. Complete and accurate documentation provides a reliable, permanent record of patient care. It provides proof of practice or malpractice. Documentation provides a basis of evaluation, the quality and the appropriateness of the care that is being provided. I can't stress to you enough how valuable and dependable the care that you provide is to these families, to the clients, and to our agency. Again, your documentation should provide the office managers with a snapshot picture of the day, what you did, an observation of how your client is doing physically and emotionally. Again, thank you, all of you, for all that you do for our clients, our families, for the office, for our agency, and let's continue to be the best that we can. Thank you.